This is the programme that tells you how to take the best care of your pet. Now, we all love our animal friends, but as we normally live longer than they do, one of the most difficult things is watching them get older. It's all part of the ageing process, of course, and one of the most common conditions that you'll find is arthritis. Now, we're going to talk about that on the show today, and with us is Rob the vet, who's going to tell us more about arthritis. What exactly is this condition, Rob?
Well, arthritis is an unstable joint trying to be made stable. The body doesn't like anything that's not working well. So what it will try and do is build small bony bridges across an unstable joint. And it acts like scaffolding. And what happens is the movement that it doesn't like then disappears. That's what arthritis is. And if your vet shows you an x-ray with little extra bits of bone growing across a joint, that's arthritis.
So obviously all animals get older, but does arthritis affect all the animals that we know?
It affects everything that's got joints. So we see it in dogs, we see it in cats, we see it in horses, we see it in humans.
And which is the easiest to diagnose in, dogs or cats?
Oh, definitely dogs. Dogs are far more athletic. We run with them, we throw the ball for them, we do agility and fly ball, and therefore we demand athletic performance, and it shows up much earlier. We'll see a limp, we'll see a yelp, we'll see them reluctant to jump in and out of the car, and these are early signs of arthritis causing pain on movement.
So that's why it's easier to spot arthritis in dogs, but what about cats?
Well, cats are exactly the opposite. They're not athletic. They've got life sorted. They're laid back, they're sitting in the sun, they don't chase a ball. It's far more difficult to diagnose in a cat.
So that's dogs, they're more active, so we can see if arthritis is affecting them, but what about cats?
Well, this is Hogan. And as best as we can find, Hogan is 26 years old and is a classic example of getting older. Now, we'll often see symptoms being presented at clinics, looking for reduced movement, looking for reduced interaction with other animals. It's very sneaky, but we'll sometimes see people bringing them in because they've got a poor coat. And they'll present as a skin problem, when actually what's happening is this guy's less able to bend around so that he can grunt. The other one that's in is a very subtle symptom, is drinking more and weeing more. If you think of yourself having a bad back, it's painful to get up and lay down. So you will wait and wait and wait to go to the toilet to make a drink. And the cats are the same. They'll lay quiet and still. They're comfortable. And they'll get up, they'll do a big wee in the litter tray, they'll go and have something to eat, they'll go and have a big drink, and then they'll go and get comfortable again. They don't want to risk being painful, getting up and down, so they tend to sit still. And owners see that they go to the litter tray, they do a bigger wee and have a bigger drink, and they misinterpret it. In a recent survey of orthopaedic surgeons, they all admit that feline arthritis is massively underdiagnosed. In a cat over 12 years old, you stand a 66% chance that they've got arthritis in their legs and an 80% chance that they've got arthritis in their spines. So if you're seeing any of these symptoms, book a visit to the vet and go and get an MOT. The symptoms can indicate other things, but they can also indicate cats in pain.
Hogan's talking to us. Well, thank you, Hogan. I think he's a grand old man. I think he's allowed to go and have another nap, don't you? Thank you, Hogan.
Thanks, mate.
See you next time. Bless him. Off for a wee sleep. Now, I didn't want Hogan to hear this, but what treatment is there for arthritis?
Dogs are far easier than cats. They tolerate a much wider range of drugs. In our clinic, what we tend to reach for first of all is a non-steroidal, and we'll use the liquid sweet tasting one. That seems to work really well. But there are different levels of drugs that we can use as the arthritis progresses. And the best person to decide on that is going to be the vet.
Okay, so that's dogs. What about cats like our Hogan?
Cats are far more difficult. They have a different liver setup, so they don't tolerate drugs as easily as dogs. Again, our first choice is nearly always the sweet tasting anti-inflammatory because they seem to like the flavour. But we're a lot more limited in what other drugs that we can use for them. In both, though, we can use the chondroprotective joint supplements. And these are there to help oil the joints and get them moving a little bit more easily. They also protect against further damage. So they work really well, and we use quite a lot of those in our clinics.